Yeah, physical and psychological pain. Yeah. So it's the physical and psychological pain, it's a free class that we're doing. I don't know, it's like in a week or two, I think. Yeah. And the thing is, we talk about pain a lot, and it's not always about the topic of pain, but somebody will say, how do I deal with this arthritis, or how do I deal with this issue in my gut? How do I deal with my shoulder? And then sometimes, even when we're talking about difficulties in social situations or in the workplace, there's still a component of pain there. And it could be emotional pain, it could be unconscious pain. There's a thing called social pain. When we're trying to fit in or we're not fitting in, there's the sense of abandonment that we talk about. There's also a pain component. And really, what we're talking about is how our body processes both physical and psychological pain. And to always be chasing symptoms brings about temporary relief. We want to look at a little bit more of what the body's doing so that we can unwind some of these effects. And granted, there are different kinds of pain, but there's a lot of things that we can do that are consistent through all the different kinds of pain syndromes, be it physical or psychological. And so part of what we're going to be addressing is conditions, specific conditions and symptoms, and how to go through and treat in a little bit of a multifaceted way, not too complicated, but right to the point, right? But also, there are certain things that we can do for prevention or when we're in the middle of a crisis or even after the fact. And so, like a headache's a good example. You get rid of a headache sometimes, and the cause of the headache is gone, but there's still the lingering pain that happens there for a little while that, your body has to reboot some of those pain mechanisms. And some of this is tied to your spine, and some of it is tied to your nervous system. Some of it is tied to like the vagus nerve, your respiratory tract, going into fight flight, so your adrenals. And there's simple ways to go through and check some of these things to make sure that your body is processing pain um, like properly. And sometimes it amplifies the pain because it's trying to get your attention, right? You already know that it hurts. You already know that you have an issue, but your body kind of is treating you like, I don't know if he gets it. I don't know if he's listening. I don't know. Maybe I have to really make it hurt so they pay attention, right? And so your mind and your body aren't always on the same page. And we want to be able to address this so that even if you're using medications, you still want to be able to augment or to potentially reduce medications that might be hard on your system, right? So we want to look at things that are consistent throughout pain syndromes. And then we want to talk about different kinds of pain and how to address them. If you have sharp stabbing pain, what does that mean? If you have dull, achy pain, what does that mean? If you have arthritis, what does that mean? And simple, straightforward ways of going through and treating it, but also let's undo the effects that this pain or this condition is having on the body, or that might have even caused some of the pains, right? So there's these theories or these applications that I have super simplified, but a lot of them have to do with how your your spinal cord processes the painful stimuli, be it that it's either physical or psychological. And so we're going to go through and learn how to like reduce pain, not just at the site, but how your body processes the pain, and then also undo some of the effects of pain. So, like anxiety is a good example. Anxiety, a lot of times, is a byproduct of some sort of pain, be it physical or unconscious, or maybe there's a psychological pain that you haven't realized, like ugh, this is a pain, right? And it doesn't mean that we have to go and relive all these experiences or have a talk with somebody if it's a psychological pain. You just reduce the pain mechanisms, right? A lot of times the body is reacting, and it's not that there's not an issue, but sometimes the body can be very enthusiastic on how it tries to get your attention with pain mechanisms, right? The more agitated the body becomes, the more intense the pain becomes. And so we're going to go through and reduce this and use it to treat a wide range of ailments, including psychological, social issues, even things in the workplace. We talk about dealing with difficult family members and things like this. All this would come into play with this. Even the idea of our karmas manifesting, right? Our karmic imagery manifesting. Part of how it manifests and can like become exaggerated is through some of our pain mechanisms. And so we go through and we unwind these pieces of information or these pieces of stimuli that might even be karmic in nature. And just because they're karmic doesn't mean they're carved in stone. There are still things that you can do. And we're going to go through it step by step. And so, hopefully you can join us. It's going to be a good class. I've simplified it. Over the years, I've taught many different versions of the pain class. And the first few times it was super technical, and I basically kind of had to burn those books. They were too technical. Like I was teaching it to nurse practitioners, and they were like, "Yeah, too much." And so, over the years, we keep refining and refining and simplifying and simplifying. And simplifying doesn't mean necessarily taking away steps. It just means like a much simpler approach, a more multiple layered approach. So we're going to use, oils, we're going to use tinctures, we're going to use body tonics, we're going to use ointments, we're going to use breathing, we're going to use mantra, we're going to use mudras. We're going to use all kinds of things. It's not always just going to be oils. And so I want to give you a very good toolkit when it comes to addressing pain, be it physical, psychological, social, karmic pains I refer to as like spiritual pains. So we want to be able to go through and address this. And so the conditioning of the past doesn't have to be a ball and chain around our ankle or a cage that we always have to sit in. So it's good for elements, but it's also good for our spiritual growth, our healing. So hopefully you can join.